Deep vein thrombosis, the leading cause of death in a hospital, that's preventable. But what is deep vein thrombosis? How can you get it, and who is at risk? Joining us with all the information is Dr. Chris Pittman, Medical Director and CEO of Vein 911 Vein Treatment Centers, and his patient, John Williams. Thank you both for joining us.
We're thrilled to be here, Christina.
And doctor, let's start by just explaining to the viewers, what is deep vein thrombosis?
Well, let's start with what deep veins are and where they are. Deep veins are actually veins in the middle of our leg in the muscle, and they are separate from veins that are under our skin that tend to cause a lot of people obvious problems like varicose veins and spider veins, but they're two separate systems. And the deep veins take 98% of our blood back to the heart. And for all sorts of reasons, blood clots can develop in these veins in the middle of the leg, and sometimes, the blood clots are a little bit like jello or a jello worm inside the vein, and sometimes these blood clots can break off and they float up through the body, through the right side of the heart and into the lungs and cause what's called a pulmonary embolism. And we all understand what choking is. It's easy to understand. But when you have a big enough clot, or this jello-y worms that go up into the lungs, they prevent blood from absorbing oxygen, and so they can cause shortness of breath and very quick death at times. And
there are obviously risk factors. We have John here, who is a patient of yours. And John, how did you first discover that you had deep vein thrombosis, or DVT?
I was experiencing some strange sensations, symptoms, if you will, in my lower legs. I had pain, throbbing sensation. So I had visited with a physician who noticed a deep vein thrombosis in my leg.
Okay, and what other kinds of risk factors or symptoms should we all be aware of?
The main symptoms you may have with a deep vein thrombosis is swelling and pain, or just swelling or just pain. But those are the main symptoms. Anybody coming into a doctor's office complaining of pain in the legs that can't be explained is generally going to get an ultrasound to rule out a deep vein thrombosis. And
are there any other kinds of tests that we should be aware of?
Ultrasound is really the main test. Of course, the history and physical and the other components of a medical exam play into that, but ultrasound is really the main modality that we use to diagnose vein issues.
And how do you treat something like this?
Treatment for DVT is generally going to be blood thinners and compression. Compression hose help a lot of people. I'm wearing some right now.
Let's see them. John, do you have some on as well? Let's see.
Yeah.
They look just like nice dress socks too, so you can wear them on a TV interview, right?
Compression hose are not like grandma's old medical hose. They're sporty, they make them casual, they make them dress, and if you have a high quality, measured, fitted pair of compression hose, they are wonderful things.
And finally, let's talk about prevention.
Standing for long periods of time isn't good because your calves aren't moving. So walking around is obviously good. Staying well hydrated, assessing the patient's risk with a Caprini score. And I believe we have more information at the American College of Phlebology's website, healthyveins.org, where people can learn more about their risk for DVT.
Okay, and John, any advice for people who may think they have some risk factors that the doctor just spoke about, or symptoms like you had?
Yeah, I would just say not to hesitate. In my situation, I was under some treatment through physician, and I still had some symptoms, and I just didn't quite feel like I had all the answers. So just be persistent and seek out a physician. Dr. Pittman and his team has been great for me, and I'm glad I didn't wait. I think it's something that you should certainly put at the top of your list.
Thank you both so much for joining us and for sharing information that could save lives.
Thank you, Christina.
To find out more about deep vein thrombosis or to assess your risk, go to healthyveins.org or phlebology.org. We'll also have information on our website at thebalancingAct.com.